Thank you, Bob, for taking the time to talk today.
Thank you, Eric.
Why did you and the other editors write a book about health policy that pretty much looked at programs not designed to have health outcomes?
Right, yeah, it's a good question. A couple of reasons. One, oftentimes decisions that we as individuals, or maybe more importantly as society, make have unintended consequences, and oftentimes those unintended consequences are maybe even more substantial than the intended consequences. So that's one reason. But more importantly, there's a fairly large body of evidence, actually quite extensive body of evidence from pretty much every country in the world, almost every time period studied, and looking at almost every health outcome that you could imagine: mortality, general health status, specific diseases, functioning, disability, and almost every single socioeconomic factors, whether it's income or education or neighborhood factors, social support, finds these very strong associations between socioeconomic factors and health and mortality. And it's persistent, as I mentioned, over time, across countries, across health outcomes, and across socioeconomic factors. So that observation really is the background and motivation for the book and what we want to investigate here. So as one specific example, if we take today in the United States, take a 25-year-old, say, who has less than a high school education, they can expect to live until about age 75. That 25-year-old, on the other hand, who has some college education, can expect to live to around 82 years old. So that's a very big difference, a difference of 7 years in life expectancies between someone who is a high school dropout versus somebody who has at least some college. Very, very large differences. So those differences were really the motivation for the book.
And what do we know about how or why social programs affect health outcomes? For example, what is known about why is there a relationship between health behavior outcomes and education, like you just mentioned?
Yeah, let's take education, the example that you mentioned. I mentioned this large association between life expectancy and education. And our goal was really twofold. One is to look more closely at education policy specifically, and also to try to tease out the extent to which that association is due to causal factors. That is, if we were able to improve individuals' education, will that necessarily translate into better health and longer life? And so that's what that was the goal of the book. And let's talk about education specifically. Some work that David Cutler and Adriana Laris-Mooney addressed in the book. There, what you see, using various methods, various outcomes, various health outcomes, drawing from numerous different studies, they find very large, substantial causal effects of aid programs, particularly to lower income students, and life expectancy. So the example that described in the book is if we were to award a grant of roughly $25,000 to a low-income student, that would translate into roughly 1 year increase in their life expectancy. So a $25,000 grant to improve their education, leading to 1 year improvement in life expectancy. So while those are in different metrics, as we call them, so how do we value a year of life? Can we put some dollar value on it? And the goal of this book is not to address the moral or ethical issues of placing a dollar value on one's life or an additional year of life, but there is an extensive body of literature that tries to do so. And that literature suggests that a 1 year of life is worth at least, at minimum, $100,000. And so here we have an investment of $25,000 in education that's reaping a benefit of 1 year of education, which suggests at least, or 1 year of life expectancy, which is at least worth $100,000. So that payoff alone, the payoff based on life expectancy and health, says that investment is worth making. And here, this was an unintended consequences. The intended outcomes, or the focal outcomes of investments in education, are typically labor market related outcomes, that it's going to improve the labor market outcomes of the individual child who is receiving the benefits from that investment, but also to society generally increase tax revenue, for example, for the government. So the intended effects, clearly important. There's an extensive separate body of literature looking at those outcomes, labor market outcomes, tax revenue. But these unintended effects are as large, if not, in fact, larger than the intended effects.
And does the current research provide enough information about the mechanisms affecting health for you to advocate specific policy?
Yeah, so I'll take that as a two-part question. So, and I think the answer to the first part, do we know enough as we should about the specific mechanisms? I'll say no. Do we know enough from this research to advocate policy? I would say yes. And definitely there's more that we need to know about the specific mechanisms. We have ideas, we have theories, we have some evidence that's consistent with certain mechanisms and not others. But I think if there's one area that this body of research needs to concentrate on, it's that. What is a specific mechanism? With that said, we do have evidence, I believe, and we talk about it in the book in many domains, education, income, and neighborhood factors, for example, that suggests that changes in these socioeconomic factors, say education or income, can and do translate into improved health and functioning in a causal way. The fact that we don't fully understand the mechanism is something we need to focus on, but the fact that we don't understand the mechanism doesn't mean that we shouldn't act on that, and that we shouldn't do things to try to, say, improve education and raise education.
Well, thank you, Bob, for talking today.
Good. My pleasure, Eric.